One of the most active drugs to treat myeloma today is a steroid. These aren't the steroids that Barry Bonds used. These are the steroids that in fact are commonly used to calm down inflammation. These are called glucocorticosteroids. They're also known as corticosteroids. Drugs such as prednisone, methylprednisolone or Medrol, Decadron or dexamethasone. These can be given in pill form or IV form. They are in fact among the most active drugs to treat myeloma today, and they're certainly cheap. The problem is their dosing, their schedule can have a big impact on their tolerability, and even the different named drugs can have different tolerabilities. Also, patients may have cataracts after long-term use. So some patients don't like being on steroids. However, it turns out dose and type of drug and schedule are everything with these drugs. In our own practice, we believe that IV treatment results in less side effects, less inability to sleep, so-called insomnia, less hyperness, if you will. We also think that when given by pill form, the methylprednisolone or Medrol seems to be better tolerated, particularly when given at lower doses every other day. We in fact know that from studies done recently that the amount of steroids that we used just 10 years ago were much too much, and although may have been effective, led to patients who had increased problems taking the drugs, especially when used in combination with more infections, more blood clots, and patients just simply not feeling well on those drugs. The results of recent randomized trials show us that less may in fact be more. Patients who can stay on drugs who have actually longer survival because they can tolerate them better when the drugs doses are reduced. And I also believe when the schedules are changed and the names of the steroids as well, you can have patients who are happier, living more full quality of lives on these drugs. We know that the steroids directly can kill the myeloma cells, but equally important, they can make the soil less hospitable for the myeloma to grow. If you will, it's no longer fertile, it's barren soil, the myeloma dies, and the patient feels better. So steroids are an excellent drug choice for myeloma patients today. Even if they're an old drug, they really do work, especially when used in combination. And what we've learned is when you combine them, you can use much less of them than we used to use when we used them as single agents before we had all these new drug choices available today to treat multiple myeloma.